Our chief congressional correspondent, Nancy Cortez, is in Washington with more on this. Nancy, good to talk to you. And let's start with that issue first about bipartisan cooperation. We heard from some key Democrats. We heard from some key Republicans in that clip. What are the chances of them working together?
Well, it's going to take one more big failure by Republican leaders to do this with simply Republican support before they decide to work with Democrats. That's simply the dynamic right now, because for every moderate Republican like Susan Collins or John McCain, who you just heard from, who said, yes, we've wanted to work with Democrats from the beginning, we actually think we'd get a better product that way, you've got conservative Republicans who would argue the exact opposite, that they want to get rid of more of Obamacare than the GOP bill does right now, that they'd like to eliminate some of these tax credits, that they would like to eliminate more of Obamacare's regulations, and that is not the kind of deal that you're going to get if you work with Democrats. So Republicans will try to make some fixes to their bill, see if they can then get 50 of 52 Republicans on board, and if they can't, then and only then will they turn to a new negotiation with Democrats.
Okay, so a new bill, and you reported this morning, Nancy, that the majority leader in the Senate, Mitch McConnell, is hoping to get something written by Friday. Is that right?
Right. They want to. They know what the universe of changes are that people want. They're very well aware that moderate Republicans feel that the cuts to Medicaid are too deep. They're well aware that conservative Republicans want some of these Obamacare regulations done away with, so you could offer some cheaper bare bones insurance plans on the individual exchanges. And so they're going to try to do that, and they're going to try to do it quickly, because they know that the longer they wait and the longer they let this hang out there, the more dug in people get. So before they go away for a week and a half and people hear from their constituents who are very afraid that their care is going to be taken away, before they face protesters, they want to get everyone on the record saying, okay, this plan, this new version works for me. But then they've still got to go back and actually write the legislative language. They've got to get it reanalyzed by the Congressional Budget Office, and that's a process that could take several weeks.
We've been seeing those Republican senators who have problems with the bill as it's written right now, and some of their concerns. And it seems like a lot of them are diametrically opposed. You know, some of them want more spending in certain areas. The more conservative Republicans who have a problem, of course, they want less spending. I'm just wondering, is it overly optimistic for Mitch McConnell, who was dealt a little bit of a political blow yesterday, having to delay this vote, to make another deadline, to say by Friday we're going to get something accomplished?
Well, what we see on Capitol Hill is that if you don't set a deadline, then things never get done, because you will always have lawmakers who are holding out. Can we try one more thing? What about this? And so leaders find that they need to put some kind of artificial deadline in place just to get everybody focused, get them to the table, and have them make a yes or no decision. And so, no, there's no reason that they have to do this by Friday. There's no drop dead date. But Republican leaders will argue that they do feel some urgency because the Obamacare exchanges are in some trouble. You have insurers who are saying all the time that they are dropping out of the exchanges in particular states, and that rates are going up in other states. And so Republican leaders say the longer that we let this hang out there, A, the longer it is before we can move on to any other subject like tax reform, and B, the more uncertainty there is in the insurance markets, because insurers are watching all of this play out on Capitol Hill as they try to make decisions about what they're going to do. How are they going to set rates? Are they going to stay in these individual markets? Are there going to be individual markets? What will they look like? And so you can't just let this hang out there forever, because it leaves so many people in limbo.
Nancy, a couple of newspaper articles this morning that got under the president's skin, talking about his involvement in the health care process, the writing of that bill in the Senate, his effectiveness in convincing some of these on-the-fence Republicans to go along with this bill. What did you hear from Republican lawmakers and their staffs yesterday after that meeting at the White House? How did senators walk away from that meeting feeling about the involvement of President Trump, as we take a look at his tweet from earlier today, talking about these stories and referring to them as fake news?
Well, publicly, they will always say it was a good meeting. We all shared our concerns. The president listened to us. But privately, they will acknowledge that the president himself is not all that effective in this discussion. First of all, because he is pretty vague on the specifics. For example, you heard him in that clip earlier say, well, it's going to be a great form of health care and it's going to be much cheaper for everybody. Well, actually, that's part of the problem, and that's part of the reason that you have Senate Republicans balking, because the Congressional Budget Office determined that actually, for a lot of people, coverage would get more expensive, because even though premiums might come down, the tax credits would be coming down as well, leaving people with higher deductibles and higher out-of-pocket costs at the end of the day. So that is exactly the problem that they are now trying to fix with this legislation. And frankly, Republicans are a bit wary about the hard sell from this president, because they've seen that while he championed the House bill right before it passed, and he was twisting arms and telling House Republicans that they needed to get on board for the good of the party, a couple weeks later, he turns around and says that that exact same bill that he was pushing for is actually too mean, and that he'd like to see something different in the Senate version. And, that leaves Republicans, not surprisingly, feeling like they have taken a bit of a risk for this president, and then that favor was not returned, because now the president has handed Democrats an attack ad in the waiting, saying that this bill that Republicans went ahead and passed was mean to the American people. So he's an imperfect salesman, even though that's supposed to be his specialty, is the art of the deal. But that hasn't stopped him and the vice president and a lot of officials at the White House from talking one-on-one to these senators to see if there's something that can be done to bring them along.